Hello viewers, in our previous video we discussed about the normal clinical features of gingiva under the headings of color, contour, consistency, size, shape and surface texture. In this particular video we will be talking about the position of gingiva. This position of gingiva varies from age to age, hence we will be coming to the topic of eruption, which can be classified into two types, active eruption and passive eruption. This will take us to the concept of anatomical crown, anatomical root, clinical crown, clinical root, etc. Watch the video till the end to understand all these concepts well. Hi, we at DentoRise welcome you all to a platform where we help you to conceptualize, visualize and memorize dentistry. So, when we talk about the position of gingiva, the position of gingiva is the one wherein the gingival margin is attached to the tooth. But this position of gingiva varies from age to age. At the time of eruption of tooth, both the gingival margin and the gingival sulcus are present at the tip of the tooth. However, as the eruption progresses, it moves closer towards the root. Having talked about eruption, according to the concept of continuous eruption, eruption does not cease when the teeth meet their functional antagonist, rather it continues throughout life. Eruption consists of an active phase and a passive phase. When we talk about active eruption is the movement of teeth towards the occlusal plane, as you can see in the figure. However, passive eruption is the exposure of teeth via apical migration of gingiva. This concept of active eruption and passive eruption distinguishes between the anatomical crown and clinical crown, and likewise anatomical root and clinical root. Let's understand these concepts in detail. Anatomical crown is the crown or that portion of the tooth which is covered by enamel. Likewise, anatomical root is that portion of the tooth which is covered by the cementum. This is according to the anatomy of the tooth. Coming to the clinical crown is that portion of the tooth which is visible into the oral cavity, or we can say that portion of the tooth which is not covered by the periodontal tissues, not covered by the gums, comes under clinical crown, as you can see in the figures over here. It even includes that portion of the tooth which is denuded of its gingiva. Coming to the clinical root, that portion of the tooth which is covered by the periodontal tissues is called as clinical root. So clinically, whatever is visible is clinical crown, and whatever is covered by the gums, whatever is covered by the periodontal tissue is the clinical root. However, anatomically, whatever is covered by the enamel is anatomical crown, and whatever is covered by cementum is called anatomical root. Hope the concepts are clear to you. Coming back to active eruption, the movement of tooth towards the occlusal plane is called as active eruption. However, after the teeth meet their functional antagonist, the process of attrism starts and it continues. So the teeth somehow has to compensate for the tooth structure loss that happens during attrism. This compensation is done by deposition of bone at the apices of the roots, at the furcation of the root, at the fundus of alveolus and the crest of alveolar bone. So there is root lengthening when the tooth structure loss is happening at the level of crown. In this way, socket depth is maintained in order to support the root. Now talking about passive eruption earlier was considered as a normal physiological process. However, now it is considered as a pathological process. According to Orban and Gottlieb, passive eruption can be classified into 4 stages. In stage 1, the base of gingival sulcus and the junctional epithelium both are present on the enamel. If you want details on what is base of gingival sulcus and what is junctional epithelium, you can check out our detailed video in the description box below. To repeat again, in stage 1, the base of gingival sulcus and the junctional epithelium both are present on the enamel. In stage 2, part of junctional epithelium is present on the enamel and the part of junctional epithelium is present on the cementum of the root. However, the base of gingival sulcus is present on the enamel only. In stage 3, as the junctional epithelium proliferates, entire of junctional epithelium is present on the cementum of the root and the base of gingival sulcus is present at the cemento-enamel junction, as you can see in the figure. In stage 4, as the junctional epithelium proliferates farther onto the root, The junctional epithelium as well as the base of the gingival sulcus both are present on the cementum of the root. This leads to apical migration of gingiva, thereby leading to exposure of root within the oral cavity, what we call as gingival recession or atrophy. The proliferation of junctional epithelium onto the root is accompanied by degeneration of gingival and periodontal ligament fibers and their detachment from the tooth. It is to note that the distance between the apical end of junctional epithelium and the crest of alveolus remains constant throughout continuous tooth eruption, which is a numerical of 1.07 mm. So to conclude, position of gingiva is the one wherein the gingival margin is attached to the tooth. This attachment of gingival margin on the tooth can be at various levels of the tooth depending upon different stages of eruption, depending upon different ages as well. Hope the video was helpful for you. If you liked our content, please do not forget to like, share and subscribe to our channel. Hit the bell icon so that you can get notified whenever we upload any new video. Suggestions are always welcome from your side. Stay tuned, stay safe. Thank you for watching.